I'm Pat Hartnett. We're here today to talk to Dr. Meena Malhotra, an internist on staff at Glenbrook Hospital. I'd like you to meet Dr. Malhotra. Dr. Malhotra, it's very nice to see you.
Hi Pat, how are you doing?
Good, thank you.
Very well. So we are going to have, we will talk about the diabetes and the care today. So Pat,
What can you tell me about diabetes?
well, I think what we should know about diabetes, everybody knows that name. It's a sweet disease, which is a potential killer. About 20 million Americans suffer from diabetes. And the problem is 1/3 of them, while suffering from it, they don't know it. The diabetes in the beginning, when it is completely reversible, and the things can be changed at that time, it doesn't bother you. So if you are not going for your physicals or seeing your doctor at regular basis, then you don't know it till it has gone too far. And unfortunately, once it has gone too far, it can damage, potentially damage your heart, your kidney, your lung, and that's when it is too late. The diabetes has done whatever it was supposed to, and that's not very pleasant. That's why we'll talk about the diabetes today, and to educate our audience what can be done about the disease before it starts harming you really. Pat.
What are the different types of diabetes?
There are few types of diabetes. There's a type 1 diabetes, type 2, and gestational diabetes. A lot of them somewhere between type 1 and type 2, we say there is a type 1.5 diabetes. Now type 1 is not, we'll talk a little bit about is, it's not something which is very common. And when it begins, it is caught very early, so it doesn't have that much time to damage your body. That's where your body does not make any insulin at all. Usually happens in the young people. Because of the complete lack of insulin, their blood sugars go sky high, they feel it right away. It's diagnosed quickly just after the onset, and it can be treated very well. Now type 2 diabetes is something different. The onset is gradual over many years. People, and here when we say 1/3 of the people don't know they have diabetes, that's mainly belonging to this group. Because of the overweight, lack of exercise, it goes on for many years before you know it. And this is happening when your body doesn't utilize the sugar as well as it is supposed to be, and your cells become resistant to insulin. The third kind of diabetes is the gestational diabetes, which happen in pregnant women. That is a diabetes which is diagnosed once you are pregnant and you seek care of a OB doctor, it is diagnosed because it's a part of regular screening. It's a regular prenatal visit checkup. So most of the time gestational diabetes is diagnosed and treated very well if you are under a good prenatal care. Hope that answers your question.
That answers the question. I do have a couple questions. It's like, who gets diabetes? Is it more men or women or?
Well, everybody. It does not, nobody can escape from it. It's something in your lifestyle. And remember, we are mainly talking about the type 2 diabetes here. It's anybody can get it, men, women, children, old, young. Nobody can escape from it if they don't practice the correct lifestyle. The first factor in the insulin resistance for the type 2 diabetes is being overweight. Overweight, sedentary lifestyle, that means you don't exercise. And here I'm going to share an interesting fact about not exercising is equivalent to exercising less than 3 times a week for 30 minutes at each session. So if you exercise even 3 times a week for 30 minutes, less than that is technically still sedentary lifestyle. So it's time to get up, wear your sneakers and go for a walk. When the weather doesn't permit, go inside, walk, on the treadmill, inside the gym. In the Glenview community, we have excellent facilities provided by the village. Get your shoes on and get moving. That's what escapes you. That's how you can control or prevent the diabetes. Adding to the things, what makes you, some people are, it's your genetic makeup. Some people are more genetically prone to develop the diabetes, others are not, and that's why some people don't exercise, still they can escape. That's where their genes are compensating for it. So basically I will say overweight, the diet, and lack of exercise. That's what predisposes you to a type 2 diabetes. And in this, if your genetic makeup is correct, you can take a far more, if your genes are strong and favoring you, then there will be, you will need to insult your body, meaning lack of exercise and unhealthy food. You can take it a little bit to an extra extent. If your genes don't favor you, you cannot play with your diet and lifestyle at all.
So in the case of exercise, so it means that I have to get out there and start exercising at least 30 minutes a day?
Correct.
3 times a week?
Yes.
Okay.
And
what if I can't do that? What if I'm in a wheelchair or I have other autoimmune diseases that keep me from doing the exercise?
that's an excellent question, Pat. And exercise does not mean that you have to jog, you have to run miles and miles every day. The best you can do for a person who is ambulatory can walk 30 minutes of brisk walking a day is suffice. You don't have to jog, you have to walk as fast as you can, and that should do. The person who cannot do a brisk walking, even a slow walk, just get up and walking, something, whatever you do is always good. For people who have arthritis or are not able to ambulate, upper body exercises and just the exercises in which they are not weight bearing, exercising in the swimming pool for the people with the arthritis, which is called as water aerobics, and our Park District center provided by the Glenview Village has some excellent facilities of that sort, could be very helpful. So the bottom line is get up and start moving, and that includes when you get to the work, don't look for a parking spot very close to your work, park far ahead. Take the stairs at work instead of the elevators. Don't be shy to walk in the store. Don't take shortcuts. Move around. Calculate your steps. They really help and they take you a long way. But one question which you asked about the people with autoimmune diseases. Now when they have any autoimmune disease or any rheumatological problem, usually those people are very stiff in the morning, so they can exercise in the evening. As the day goes by, any kind of rheumatological problem or the body's stiffness eases. So it's not that only 6 o'clock in the morning is the time to exercise. Whenever your schedule permits, any time is good. It's really going to take you a long way.
Good. What causes diabetes? I've read everything from viruses to different illnesses, or...
Yes, and this is where, we just talked about a few minutes ago. Viruses or illness or autoimmune factor, these all mainly play a role in type 1 diabetes. It is believed that viral illness or something triggers the autoimmune response in your body, and your body starts destroying your own pancreas, or we should say beta cells, which produce the insulin, and that leads to a complete lack. Unfortunately, we don't know exactly what antibodies, what viral illness triggers it. We know it only after it happens. The research is still in progress, and hopefully one day we will be able to identify, and then we could even cure type 1 diabetes. But type 2 diabetes is not one thing which promotes it. It's over the years, your lifestyle, which leads to the type 2 diabetes.
Okay. How do I know if I'm at risk for diabetes?
Well, it's again, If any of these risk factors, what we talked about, or you have any of those things in your lifestyle, you are at risk of diabetes. If you are overweight, and a very good formula to find if you are overweight is by calculating body mass index, which is also mentioned in BMI. This is something where you should be visiting your doctor once a year for your annual physicals. Your BMI can be calculated, and if it is more than 25, you are overweight. And only you know if you go for your exercise with your dancing shoes or not. So if you feel you are in one of them, go for your physical, go for your annual visit. That visit, when you feel well and you see your doctor, can really take you, save many more visits to see your doctor when you don't feel well. So visit your doctor when you feel well once a year, and that will take you a long way.
Great. What are some of the signs of diabetes?
This question can be, let's keep it separate for the type 1 and type 2. Type 1, because all of a sudden your blood sugar goes very high, you feel fatigued, that means complete lack of energy, increased thirst, increased urination, weight loss, infections happening too soon, too quickly, yeast infections for women, or infections not healing so quickly, leg sores or foot ulcers. These are all the signs that something is brewing, and you should seek the medical attention immediately.
Doctor, how do I take care of myself if I'm diagnosed with diabetes?
Once you have taken that big step to go see a doctor and you have been diagnosed with diabetes, it is something which you will probably carry for rest of your life. Now, if it is real early and it is pre-diabetes, then you can remove that flag from you. But if it has gone too far, it's something which you carry with you for rest of the life. You can feel it as a trophy carrying with you for rest of the life, because I have had patients who have, it's interesting, she told me that the diagnosis with diabetes was probably the best thing what happened to her. She was not feeling well, she was not taking care of her. Ultimately, she went and saw the doctor and got this diagnosis of diabetes. After the diagnosis was made and she had this detailed discussion about her lifestyle modification and her medication, she feels like a different person. She has changed her lifestyle, she has lost weight, she's fitting into beautiful dresses which she never did before. She is eating healthy, she feels full of energy, and she has a routine, a much healthier routine sets. She feels good about herself and about her illness. And she told me last time that this has come as a blessing from God to her. I'll say, when you are taking care of the diabetes, first step is lifestyle modification, which is more important in type 2 than type 1. Not to say it's not important in type 1. Actually, I should correct myself and say the lifestyle modification is the basis of the treatment for any kind of diabetes you have. The first is you have to start exercising. I cannot emphasize this anymore, how important it is to just walk for 30 minutes a day. Walking is, if you can take out time from your schedule and go out for a walk, that's great. If not, find time to walk at work. Park away, take a longer way to the work, taking the steps at the work instead of the elevator. Sometimes I even hear some corporations do the meetings in the afternoon while also taking a walk. They are just not taking the notes, but it is a much less formal setting for a meeting. People are more relaxed, and they are also getting their share of the exercise for the day. The second step is the diet. The first step in settling the diet is to figure out how many calories do you need a day, and your doctor can ascertain this for you. After you know how many calories you are going to take for a day, you have to divide it between the carbohydrates, proteins, and fats. As a general guideline, 60% of your total calorie requirement should come from complex carbohydrates, fruits, and vegetables. 30% of your total calorie requirement should be coming from protein, and 10% of it should be coming from the fat. We'll take one at a time. When we say 60% of the calories should be coming from complex carbohydrate, that means whole grain. Any kind of whole grain is great. Remember, all carbs are not bad. As you refine the carb, it loses all its property and really becomes close to a slow poison to your body. The more you take it away from its natural state, as you take out the skin from the grain and refine it, the whole grain flour into a white flour, it is really a slow poison to your body over many decades. This is something which tells you why the diabetes and the heart disease is becoming more and more prevalent now, because we are refining the food too much. The sugar is refined, the flour is refined, and that's the fructose sugar, the corn syrup. This is all slowly destroying your body. It's time you eat any kind of grain, whole grain, close to its natural states. Fruits and vegetables, with few exceptions, almost all of them are good for you. It's a misconception that if you have diabetes, you cannot have sweet fruits. The sugar in the form of fruits, if it is still fitting in your total calorie requirement for the day, it is good for you, because you are getting fiber and lot of other minerals and vitamins from the fruit which your body needs. What you shouldn't take is free sugar in tea, coffee, juice, or in any other baked product like cake, pastry, donut, muffin. The combination of white flour and sugar is really bad. So it's time that you start pay some more attention to your cookbook, your recipes, spend some time in kitchen, and you can take a bigger control of your life. The second step is about the proteins. Proteins from any source, dairy sources, egg whites, chicken, turkey, fish, baked or boiled. You remember, you have to limit your fat intake to less than 10% a day, is going to be great. You have to limit your red meat intake if you have calorie restrictions and you have to lose the weight, because that is a dense source of energy and a lot of calories coming from a small piece of meat or a food, I should say. About the fat intake, total should be less than 10%, and it should come in the form of unsaturated fat. Unsaturated fat like canola oil, olive oil, almond oil, nuts in which they're like pecans, almonds, walnuts are great. Saturated fat, which usually comes from the animal sources, like in full fat dairy, lard, is not good. It is known and it is proven to promote the heart disease and the progression of diabetes. So as long as you stick to these guidelines, please have a detailed discussion about the diet at your next visit with your doctor. That will really help you and minimize the requirement of the pills you are going to take. After the diet, Pat, the second step is about the medication, and they can be done as an oral medication or injections of insulin. The oral pills form in many classes, and I think this can be more appropriate. It needs to be, the diet is for everybody, but the pills has to be according to what you need, where your kidney function is, and where overall your health is. This is best discussed at your next doctor's visit. Discuss about the pills. There are a lot of options, and after that the final treatment will be the insulin if you have failed the oral therapy, or for some people, even the insulin has to be started in the beginning to get a hold or get a good control over the disease first, and later on you can be changed to oral tablets.
Does this criteria fit for gestational diabetes too?
Gestational diabetes, diet and lifestyle fits for everybody. That's just a healthy lifestyle, which it doesn't matter you're type 1, type 2 or gestational, it fits for everybody. For gestational, the treatment is diet, exercise and insulin. The tablets are not taken during the pregnancy because they cross and go to the baby and can be harmful for the baby. So for them, if they need any medication, that's going to be the insulin.
Okay. Are there any cures for diabetes right now?
I should say no and yes, both ways. For type 1, we don't have a cure right now. There's a lot of research going in it though, and one day we might have a cure for type 1. Type 2 there is no cure for it once it is progressed far enough. There is a cure for pre-diabetes. That's if you are between normal and the frank definition of diabetes, that's your fasting blood sugar of more than 126 or oral glucose tolerance test. If there is a particular detail which your doctor can discuss with you, if you have between normal and frank diabetes and you get really strict control of your lifestyle at that point, it can convert back to normal. So pre-diabetes can be cured with permanent lifestyle modification, and you can just stay without pills as long as you stick to your lifestyle. But once it has progressed far enough, no, there's no cure for it. It's going to be a maintenance.
So then, as far as prevention, it's weight loss,
Correct.
diet, exercise.
Correct.
Okay.
You said it all, Pat. If you do these things, 60% of the treatment is right there. That's where weight loss, weight loss, weight loss. That's what I say.
How does weight loss affect diabetes? I mean, such as myself, I'm a little bit overweight but not obese, but how does the weight affect?
If you remember, Pat, what we talked about in the beginning of the talk, the type 2 diabetes there's not lack of insulin. It's your body is not utilizing the sugar because the cells are becoming resistant to insulin. Now let's explain it a little further. Because of the extra fat in your body, fat for a long time was thought to be an inactive organ. People thought it's just there, it looks ugly and it doesn't do anything in the body. But now we know that's not what it is true. It makes a lot of hormones and a lot of chemicals in the body which doesn't let your body use the sugar the way it should. And all that sugar pools in your blood and you become diabetic. That is why this is called as insulin resistance. If a certain amount, I think I should make this statement before, for the glucose to reach from your blood to every cell in your body, you need insulin. The cell, when there are inflammatory factors from the fatty tissue around your body, they need more and more insulin in order for that glucose to go from your blood to your cell. And this is called as insulin resistance. So if you remove the fat and take away all those inflammatory mediators, then the sugar can pass to your body cells with a little amount of insulin which your body can produce. And here, by losing the weight, you have cured the prediabetes. So in here, losing weight doesn't mean if somebody is overweight, you have to lose 50 pounds or 100 pounds. Even 1 or 2 pound counts. So every pound, every ounce counts. Don't be discouraged. I know it's very hard, very difficult, easier said than done. But get your shoes on and get walking. That will help. That will take you a long way in your life.
I've heard it's harder to lose weight once you're diabetic. Is that true?
No, no, that's not true. It is hard to lose weight no matter where you are, if you are diabetic or not diabetic, because it takes, and once you lose the weight by correct way, the diet and the exercise, and lose it slowly, it sticks along with you longer, and you get the most metabolic benefits from you. People who go on crash diets and try to lose 5 or 10 pounds real quick, that does not stick with you and can be really harmful for you in long term. So slow and steady wins the race.
Okay, great. I heard that there's new technology coming out as far as a type of gluco watch.
Yes, that is something which is coming in. You know, what diabetics fear is pricking their fingers and getting the sugar check. That is a big thing which inhibits people from seeking medical attention. So this is something which can check your sugar without pricking a finger. It is something which you wear on your wrist just like a watch, and it measures the sugar amount in the sweat, so, or the secretions from your body. So it is a non-invasive way of checking your blood sugar. Neat.
Well, thank you, Dr. Malhotra. I just wanted to let everybody know that they can go to the website, the American Diabetic Association. You can also call the number that you'll see on the bottom of your screen. And we will have more information for you on other illnesses, hopefully in the future, with Dr. Malhotra. We look forward to visiting with you again.
Thank you.